Hello, and thank you for your interest in this project called Use of the methyl fumarate in type 1 diabetes. My name is Francesco Vendrame, and I'm a physician scientist at the University of Miami.
Hi, my name is Allison Bayer, and I'm a cellular immunologist here at the University of Miami at the Diabetes Research Institute.
So one very common question I hear from my patients is about new therapies for type 1 diabetes. Is there anything new? How long we should wait for a cure? This is a question with not an easy answer, since we know that developing and testing new therapies for any disease is a long process, which requires many years before a new medication becomes available. So in the recent years, there has been an increasing interest in what is called drug repositioning, which basically refers to the identification of new indications for existing drugs. And I think that here a very famous example is the sildenafil for erectile dysfunction. So you may wonder if there is any of such drugs which can be used for type 1 diabetes. And we believe that the answer is that there is one of such drugs.
The dimethyl fumarate has been used in Germany since 1994 for the treatment of psoriasis, which, like type 1 diabetes, is an autoimmune disease. More recently, a few years ago, the dimethyl fumarate has been approved by the FDA for the treatment of another autoimmune condition, which is the relapsing remitting multiple sclerosis, which is the most common form of multiple sclerosis. Data in animal models of multiple sclerosis and in humans have shown that the dimethyl fumarate significantly improves the clinical condition of these patients by targeting the immune response. Studies about the mechanism of action of this medication shows that the target of this drug are also desirable targets for treating type 1 diabetes.
So what's our plan? So our long-term goal is to launch a clinical trial to test whether DMF, the dimethyl fumarate, preserves insulin secretion in type 1 diabetes. However, as a prerequisite, a clinical trial would have to be supported by preclinical data that demonstrate its efficacy in a relevant model. And for this reason, our project aims at testing this drug in the NOD mouse model, which is the widely accepted model of type 1 diabetes. We already generated some preliminary data in NOD mice, which were treated with this medication. And again, although these are preliminary, this data suggests that the dimethyl fumarate can indeed modify the course of the disease. At this stage, your support is extremely important. Being able to move fast through these preclinical studies means that we can start testing this drug in patients with type 1 diabetes.
Dr. Vendrame and I have a complementary expertise in the study of type 1 diabetes to carry out this project. We believe that this project merits funding because 1, it's supported by strong rationale, 2, it's feasible, and 3, it can readily translate to a clinical application. Thank you for watching our video.
Thank you.